So here we have a slit lamp view with the lens in place. So we're going to get the patient to blink, and we're just going to observe the post-blink movement in the primary position. Also in the primary position, we want to look at the lens centration. So you want to make sure that the lens is centred, and we're also going to look at the coverage, which also makes sure it's covering the entire cornea. Now we're going to get the patient to look to the right, and we're just going to observe the lens lag, and this is how much the lens moves horizontally when the patient looks from left to right. So ideally this should be between 0.2 and 0.4 millimeters. However, if you are unsure, you can consult the manufacturer's specifications for the lens that you're fitting, and this should give you an indication of how much it should move. Then if we get the patient to look up and look down, we can look at the lens sag. Now this is how much the lens moves vertically when the patients look up or down. Ideally this should be about 0.2 to 0.4 again, and you can also consult the manufacturer's guidelines to see what it should be. Now it's important when you're looking at these different positions of gaze that you just keep noting the lens coverage, so make sure the lens is covering the entire cornea, and noting the lens centration, just making sure that the lens is completely centred in all these different positions. So now we're going to do the push-up test. This just gives you an indication of how tight or loose the lens may be. So you want to get the patient to look up, blink, and then with your thumb just push the lens up, and then from there you just want to note the recovery and how much movement you get. So you record this between 0 and 100%, where 0 is you push the lens and it falls off the eye, and 100% you push it and you get no movement whatsoever. Okay, so we're just going to show you how to take a soft contact lens out the eye now. Same as before, explain to the patient what you want to do so they're not going to get any shocks. So what I want to do, so you just look down for me, Sean. Same as before, just grab the lashes just at the base, use your finger. Just hold that down. If you look straight ahead for me, Sean. That's great. Look in towards your nose. At this point, you just want to pull the lens off, right off the cornea, then just pinch it off. Like that. There you go.